RN to BSN program is developed for graduates of diploma and associate degree nursing programs who are wanting that opportunity to complete the requirements for a Bachelor of Science in Nursing degree. It's an online program. There's 30 credits of nursing courses in the program. There's also 3 core prerequisites that have to be taken: English 101, 102, and statistics. Depending on what type of associate degree or diploma that a nurse graduates with, they may have to also complete the general education foundation requirements for the university. But that's something that we can work with each individual student to let them know what their needs may be as they enter the program. Someone who's already graduated has an active registered nursing license that's unencumbered, meaning there's no disciplinary issues or issues with their license. Is a perfect candidate for this program. Because it's online and our progression plans, we have 3 different progression plans that students can choose from, and they're flexible. It makes it achievable for those who are working full-time, have families, significant others, just a very busy lifestyle. And I think that's one of the most important things about our program that nurses need to know, is that it is doable working full-time and having a life. Obtaining a Bachelor of Science in Nursing degree opens up many doors for a registered professional nurse. There may be doors opened in leadership, managerial type positions that weren't there before, public health and community-based health positions. Some of those positions would require nurses to have a baccalaureate degree. And also it lays the foundation for anyone who is wanting to pursue a graduate degree in nursing or maybe another field. Every student who's admitted to the program gets in-state tuition, so I think that's really important. So anyone can apply for our program and pay in-state tuition. Interested students are always concerned because on the website it does talk about clinical experiences. These experiences are nothing like what they have experienced in traditional nursing programs. We have incorporated, these are more like clinical projects that we've incorporated into classes. For example, students will create an evidence-based nursing practice plan as part of one of their courses, where they take a nursing issue that they've identified in their work setting, and they'll work through a process of coming up with a plan of change and how that could possibly be implemented in their work setting. And it's just a proposed change. It's not something that they, go and actually implement the change, but that's just an example of how clinical experiences differ in the RN to BSN program. So it's something that they can do where they live, where they work. It's not something that they have to worry about traveling to other institutions or agencies. We have very good faculty who have taught in the RN to BSN program for years, so we know what we need to teach in terms of concepts that are related to RN to BSN students. And I think they'll find that faculty are very willing to work with them. We meet with them via phone, Zoom, or even if they're local, we can meet in our office. So I think they would find that they have lots of resources, accessibility, and again, that flexibility that they need. We are sort of a flagship institution in our state, so to be able to say that you've graduated with an RN to BSN degree from WVU School of Nursing, even though you may be, for example, a Charleston student, you may be categorized on a different campus, it's the same program because it's an online program. It's taught throughout, all campuses, students. So I think that's very important to think about. And we have a long tradition of very good nursing programs at WVU. Even if they're staying in their same role as maybe a bedside nurse in acute care, they're able to, I feel like, connect that acute care experience more so to now what happens when the patient leaves the hospital in the community setting. They have more of an idea about the leadership that goes on, decisions that have to be made, and especially evidence-based practice, how much that plays into decisions that nurses make and interventions that they implement. It also, again, opens doors for different career opportunities and also, furthering your education.